All right. Thank you for joining today's webinar. I think we can go ahead and begin. So today's webinar is an introduction to new Gateway Data Enclave cross-country analysis data sets. We're going to be presenting kind of two new cross-country analysis data sets that our team has designed that are available on the Gateway Data Enclave. If you have any questions or would like any clarifications during the webinar, you can ask them in the chat panel or in the question and answers panel, and we're going to leave time to answer those questions at the end of today's webinar, which is also being recorded and will be made available on the Gateway website. Um, so let's start with the need for better data sharing. Access to many of the Health and Retirement Survey International Network of Studies is straightforward, but it's not straightforward for all of them. Accessing linked data sets, especially those combining survey and contextual data, can remain challenging to do those linkages. And so users are often encountering barriers when they conduct multi-country analyses because you don't just have to get access to one of the study's data, but access to multiple through different channels. Geographically linked data offers new opportunities to study environmental effects, but also raises some privacy and access concerns, particularly for studies as they want to be able to ensure privacy for the study participants and are very careful about revealing too fine of geographic information. And also, the NIH implemented a new data management and sharing policy at the beginning of 2023, which requires that all studies that are doing primary data collection have to have a plan for managing and sharing their data widely. So the Gateway Data Enclave is kind of set up for the Health and Retirement Network of Studies to kind of facilitate this data sharing. It's a secure remote access computing desktop that allows researchers to analyze publicly available and restricted or sensitive data from HRS INS while safeguarding data sources from unauthorized access and use. It's hosted on the NIA Data Linkage program, which uses the SkyShaper platform. And it includes analytic software like R, SAS, Stata, and other productivity software that you would want to use to conduct an analysis. To register as a user on the Gateway Enclave, we try to make the process very straightforward. There's two levels of registration. One is a public use data access, and one is sensitive use data access. So for public use data access, you would indicate which studies data access you're applying for. You can also indicate if you would like to have a shared workspace with other Enclave members. So if there's other members of your team who want to work on the same data files on the Enclave, you all can list each other and have access to each other's work. And then you agree to the data use agreement, which says that you make no attempts to identify. If it happens incidentally, you would report that statistics based on cell sizes of less than 5 will not be allowed for export or publication. And all use is for scientific research. All commercial use is prohibited. The sensitive data application is very similar to the public use data application with kind of the added requirement that you need to show an IRB approval covering the research on the sensitive data that you propose to do on the Enclave from your institution. And then everything else is basically the same. It is up to the studies themselves to decide whether they want to classify their different data as public use or sensitive use. I will show you in just a few slides what are the data that are classified as public use and sensitive use, so you will have an idea if you need to get access to the sensitive use data access application, which we understand going through the IRB process, even if it's considered exempt, can still take some time. And to register as a user, you first register with SkyShaper and you complete remote identity proofing. You'll be required to set up two-factor authentication to log into the Gateway Data Enclave. And one current restriction is that, and this is a linkage platform restriction, is that the Gateway Enclave is currently only available to users in the US who are affiliated with the US-based based institution and have a US government issued photo ID. So we know that is a hurdle for a lot of researchers who don't fit these exact criteria. And we are kind of trying to work to expand this. And we have a partnership that we're developing with 80 Data Initiative. They host a rich collection of Alzheimer's and dementia data. And they have their own kind of enclave setup called AD Workbench, which is a secure cloud-based data sharing and analytics platform. And one of the especially added advantages is that AD Workbench allows registration and access for non-US based researchers. So we're basically building kind of a strategic partnership to establish an expansion of the enclave on AD Workbench that would allow for non-US based researchers to access Gateway harmonized data. Currently is still in the process, although it's moving along. We hope that it would be able by the end of the year to be able to kind of be fully launched. But we're just making sure that each study that's deposited their data is agreeing to deposit on both versions of this enclave. But we're excited about this development. So when you use the Gateway Data Enclave, you're going to use it by logging into a secure web browser. From that web browser, you can upload any external files or data that you would want, in addition to the data that's already provided to you as part of the Gateway Data Enclave that you said you wanted access to in your application. So this could be different data sets that you wanted to do comparative analyses with that aren't on the Data Enclave itself, or it could be data that you plan to kind of contextualize, help contextualize the data that's provided on the Enclave. You can explore, develop, and develop your analysis code on the Enclave. And then you can run those analyses within the secure environment. Again, there is R, SAS, and Stata are provided as part of the Gateway Data Enclave. No data is allowed to be exported off of the Enclave. But once you have some outputs, whether those be regression outputs or statistical summaries or figures that you've generated as part of your analyses, you can submit those for disclosure review. So you submit those. There's a compliance officer for the Data Enclave who then reviews those. We try to review within 24 hours at most. And then you can download your approved results off of the Enclave back onto your home computer. And the Enclave is available at any time for you to use without any fee. So the public use data that's available in the Enclave includes data from the Health and Retirement Survey from the US. This includes both kind of harmonized data files like the RAND-HRS longitudinal file, our kind of Gateway harmonized end-of-life data, life history data, COVID data, as well as core interview data from 2002 forward. We also have data from the English Longitudinal Study of Aging, or ELSA. In addition to the types of files that we have available for the HRS, we also have a harmonized version of the ELSA HCAP data as part of the public use data on the Enclave. The Longitudinal Aging Study in India, LASI, has one wave of data currently, and there's a harmonized version of that data, as well as a harmonized version of LASI-DOD, which is their HCAP, or Harmonized Cognitive Assessment Protocol interview. LASI-DOD also has SSU-linked environmental exposures that are part of their public use data that's available. So these are environmental exposures, but they are not linked to the geography of the household, but they're linked to the geography of the secondary sampling unit or kind of the locality at which the interview took place. We have data from SPS, the Chilean Social Protection Survey, NICOLA, the Northern Ireland cohort for the Longitudinal Study of Aging, and we have just the harmonized data for Corellis, the Costa Rican Longevity and Healthy Aging Study. The sensitive use data that's available in the Enclave include the harmonized version of the HRS HCAP, that Harmonized Cognitive Assessment Protocol. That's as part of the sensitive use version of the data. We also have household-linked environmental exposures for ELSA and ELSA HCAP. as well as La Ciudad, the Indian HCAP study, have household-linked environmental exposures that are available as part of the enclave. Um, and finally, our team has kind of undergone the work of building some cross-country analysis data sets that we think are like on particular topics that are of interest to researchers and could be very fruitful for use for researchers. So we try to combine different parts of the data together into one place. We have two of these, which we launched right at the start of the Gateway Data Enclave about 2 years ago. Those are the Longitudinal Functional Limitations Dataset. This has data from both the HRS and from ELSA on changes in functional limitations over time. We developed a cross-country harmonized cognitive assessment protocol, or HCAP dataset, that has data from the US, England, Chile, and India that includes harmonized cognitive variables and data on hypothesized risk factors and early life exposures from the linked core studies in combination with those cognitive-based outcomes from the HCAP study. And then we have two new data sets that we've just designed, which this webinar is really meant to introduce you to those. The first is the Longitudinal Chronic Conditions Dataset, which Zichi is going to be telling you about shortly. So this combines harmonized data from the US and England to support research on chronic disease prevalence, multimorbidity, aging diagnosis, recent diagnosis, modifiable risk factors, and related covariates. And a cross-country social isolation data set, which Yizo has helped design, and he's going to tell you more about that. But it combines harmonized data from the United States, England, India, Chile, and Northern Ireland, and it supports research on social isolation, loneliness, social network, family contact, social activities, health outcomes, and related risk factors. So with that, I'm going to turn it over to Zichi to tell us more about the new longitudinal chronic conditions dataset.
Good morning, everyone. Today, I'll be introducing the Gateway Enclave Cross-Country Analysis Dataset on longitudinal chronic conditions. This dataset was developed to support researchers interested in studying chronic condition patterns across countries using harmonized longitudinal data. It combines information from the United States and England and provides a standardized framework for examining chronic conditions, associated risk factors, and disease trajectories over time. In the next few minutes, I'll be discussing the motivation behind the dataset, what information is included, how chronic conditions are measured, how the data are structured, and how potential research and some potential research opportunities. To begin with, why do we need cross-country analysis? Chronic conditions are one of the leading causes of disability and mortality over the world, but their prevalence and patterns differ substantially across different countries. These differences may reflect variations in healthcare systems, socioeconomic conditions, public health policies, and lifestyle behaviors. Cross-country analysis allows researchers to identify which patterns are universal and which are shaped by local context. However, meaningful comparisons can be difficult because studies often use different questionnaires, coding schemes, and variable definitions. This dataset addresses that challenge by harmonizing data using consistent definitions and aligning survey waves across studies. As a result, researchers can conduct more reliable international comparisons and to better understand how healthcare systems and social environments influence chronic condition outcomes. The dataset currently combines harmonized data from two major longitudinal aging studies. The first one is the Health and Retirement Study, or HRS, from the United States. And the second one is the English Longitudinal Study of Aging, or ELSA, from England. For HRS, the datasets include waves 6 through 16, covering the period from 2002 to 2022. And for ELSA, the dataset includes wave 1 through 11, also covering 2002 to 2022. Together, these studies provide approximately 2 decades of longitudinal data, allowing researchers to examine both cross-sectional differences and long-term changes in health and aging. The dataset contains three major categories of information. First, chronic conditions. This including cardiometabolic conditions, cardiovascular diseases, respiratory diseases, neurological conditions, mental health conditions, renal disease, cancer, musculoskeletal conditions, and vision-related conditions such as glaucoma. Second, modifiable risk factors are also included in this dataset. This include smoking, alcohol consumption, physical activities, anthropometric measures, sleep characteristics, medication use, and healthcare access. Third, we include a rich set of covariates. These cover demographic characteristics, socioeconomic indicators, employment status, childhood socioeconomic circumstances, parental education, and childhood health measures. Together, these variables provide researchers with a comprehensive framework of examining both burden of chronic disease and the factors associated with disease development and progression. Now that we've discussed what included in the dataset, let's take a closer look on how the chronic conditions are measured. A key feature of this dataset is the harmonization of chronic condition measures across studies. For most chronic conditions, we provide three complementary measures that capture different aspects of the disease history. First, whether an individual has ever been diagnosed with a condition by a doctor. This measure captures lifetime prevalence and provides a standardized way to compare disease burden across countries. Second, for certain conditions, age at diagnosis is also included. This approximates the timing of disease onset and enables researchers to study when conditions emerge over the life course, as well as patterns of disease progression. In addition, because age at diagnosis is available across waves, researchers can also identify newly diagnosed cases during the follow-up periods. Third, for selected chronic conditions, we include information on treatment status, such as whether respondent is receiving treatment or taking medication. These measures allow researchers to examine disease management, healthcare utilization, and differences in treatment patterns across countries. In summary, these measures provide a more complete picture of chronic disease occurrence, timing, and also management. Because the data are harmonized and longitudinal, the dataset supports several types of analysis. First, it enables cross-country analysis. Researchers can compare chronic disease prevalence and patterns across countries using consistent definitions and aligned survey period. This helps identify similarities and differences in health outcomes across different social and healthcare environments. Second, it supports risk factor analysis. Researchers can examine how behavioral, social, and economic factors such as smoking, alcohol use, physical activity, sleep, and socioeconomic status are associated with chronic diseases. Third, the dataset facilitates multi-morbidity research. Because multiple chronic conditions are included, researchers can construct multi-morbidity indicators and study the co-occurrence of diseases and how disease clusters differ across populations. Finally, the longitudinal analysis. Researchers can follow individuals across waves to examine disease progression, new diagnosis, and changes in health status over time. Overall, this capability makes the dataset useful for a wide range of research questions related to aging and chronic conditions. In addition to the data file itself, extensive documentation is provided. The codebooks describe variable names, label, coding schemes, and wave-specific availability. We also document the harmonization process, including how measures were aligned across studies and any important study-specific differences. Comprehensive documentation is critical because it improves usability, supports reproducible research, reduces data preparation time, and facilitates appropriate cross-country comparisons. Our goal is to allow researchers to focus more on scientific questions and less on data cleaning and harmonization. The dataset is available in both long and wide formats. This slide shows an example from ELSA using the hypertension diagnosis variable. On the left is the long format, where each row represents one individual at one survey wave. In the example, the same respondent appears multiple times, once for each wave, with hypertension status recorded separately at each interview. Notice that in wave 1, the hypertension variable is unavailable, while beginning in wave 2, the respondent reports no hypertension until wave 5, where the respondent first reports having hypertension diagnosed by a doctor. This format is particularly useful for longitudinal analysis because it allows researchers to directly model changes over time and identify when health condition first occurred. On the right is a wide format, where each respondent appears only once. Instead of multiple rows, each wave-specific measure is stored in a separate variable, such as the name and such as R plus wave number plus variable name, and so on. This format is often convenient for descriptive analysis, creating summary measures, or when researchers prefer to have all information for an individual contained with a single record. By providing one long format file and one wide format file for each study, the dataset supports a variety of analytical approaches and accommodate different researchers' preferences. I'll conclude by highlighting some potential research applications. One area is multimorbidity research. Researchers can investigate on how combinations of chronic conditions vary across countries and populations. Another opportunity is risk factors analysis. The dataset allows researchers to examine whether behavioral factors such as smoking, alcohol use, physical activity, and sleep have similar associations with chronic conditions across different national contexts. Researchers can also study socioeconomic disparities in health, including whether age at diagnosis differs across socioeconomic groups. Because the dataset contains longitudinal information, it can be used to examine disease progressions and changes in health over time. More advanced applications, including time-aligned cohort comparisons and analysis of cross-country heterogeneity in disease trajectories. Overall, the dataset provides a valuable resource for understanding health aging and cross-disease dynamics from an international perspectives. Thank you for your time. I hope this overview have provided a useful introduction to the longitudinal chronic conditions dataset and the research opportunities it offers. I'd be happy to answer any questions.
Thank you, Ziqi. I'm Ijo. So today I will be giving a brief introduction to the Gateway Enclave cross-country analysis dataset on social isolation. So this dataset was developed to provide a harmonized resource for studying social isolation among older adults across multiple countries. By bringing together several international aging studies and standardizing key measures, the dataset allows researchers to examine social isolation, its determinants, and its consequences in a comparable way across different social and cultural contexts. So social isolation has become an increasingly important topic in aging research and public health. So as populations age, maintaining social connections becomes a key determinant of healthy aging. Previous studies have shown that socially isolated individuals are more likely to experience depression, loneliness, and declines in physical functioning. The issue has become so important that some governments have begun treating it as a policy priority. For example, in 2018, the United Kingdom appointed the world's first for loneliness to address the growing impact of loneliness and social isolation on population health and well-being. This reflects increasing recognition that social isolation is not only an individual issue, but also a broader societal challenge. Social isolation is shaped not only by personal characteristics, but also by broader social and environmental contexts, including family structure, neighborhood conditions, and access to community resources. Because many countries are facing similar demographic changes, understanding social isolation from an international perspective has become especially valuable. So the dataset combines harmonized aging studies from 5 countries, the United States, England, Northern Ireland, India, and Chile. Together, these studies provide a large and diverse sample of older adults across a variety of social, cultural, and policy contexts. One important step in constructing the dataset was selecting survey waves that were as close in time as possible. Because these studies were conducted independently, data collection did not occur during exactly the same years. So to improve comparability, the way from each study that most closely aligned with the 2018 to 2019 period was selected. By aligning studies to a similar time frame, we minimize the influence of differences in survey timing and ensure that observed differences across countries are more likely to reflect real differences in social isolation rather than differences in when the data were collected. Next slide, please. Thank you. The dataset includes several dimensions of social isolation. These measures are shown in the first column and include marital status, living arrangements, social network interaction, contact with children, relatives, and friends, as well as participation in social activities. Together, these variables capture different aspects of social connectedness and social isolation. The second column includes outcome measures such as loneliness, depressive symptoms, measured using CESD scales. These outcomes help us examine how social isolation relates to mental health and overall well-being. The dataset also includes several potential risk factors, including activities of daily living, instrumental activities of daily living, neighborhood disorder, and transportation access, including driving ability and public transportation availability. These variables allow researchers to look at both environmental and functional factors that may be associated with social isolation. Finally, the dataset includes a set of demographic and socioeconomic covariates, including age, gender, education, labor force status, and wealth, which can be used to characterize populations and control for potential confounding factors in analyses. Before moving on to the potential research opportunities supported by this dataset, I'd like to briefly highlight how the dataset is structured. The dataset is provided in a wide format, an analytical file, where each row represents a single respondent and each column represents a harmonized variable. This structure makes it straightforward for users to conduct descriptive analyses, regression models, and cross-country comparisons without additional data restructuring. As shown in the example at the bottom of the slide, each respondent has a unique identifier and associated demographic, social, health, and environmental variables contained within the same record. To improve consistency across studies, the selected waves from each survey were also realigned to a common wave 1 designation because the original studies began at different times and used different wave numbering systems. This alignment provides a standardized framework for users working across datasets. Finally, we provide a detailed codebook that documents variable definitions, coding schemes, and harmonization decisions. Together, the dataset and accompanying documentations are designed to help researchers quickly understand the dataset structure and begin conducting cross-national analysis with minimal additional preparation. Beyond harmonizing measures across studies, the dataset enables direct cross-national comparisons of social isolation and related indicators. So the figure on the right provides a simple example using one of the variable included in the dataset, the number of people living in the household to capture the percentage of the respondent who is living alone. We can see substantial variation across studies, ranging from about 3% in Lassie to 26% in Nicola. These differences highlight why cross-national data sets are valuable. Living alone may have very different social meanings depending on family structures, cultural norms, and social support systems. The data set allows researchers not only to compare prevalence across countries, but also to investigate whether the causes and consequences of social isolation differ across social and cultural contexts. More broadly, the harmonized structure supports theory development, improves statistical power through pooled analyses, and provides evidence that can inform policies aimed at reducing social isolation among older adults. Mm. To conclude, I like to highlight a few examples of the types of research questions that this dataset can help address. So researchers can examine whether the drivers of social isolation are universal or whether they vary across countries with different family structures and social norms. The dataset also makes it possible to investigate whether social isolation and loneliness represent the same experience across cultures, or whether their relationship differs in different settings. In addition, researchers can explore how neighborhood environments influence social connectedness and whether social isolation has similar impacts on mental health and physical functioning across countries. By providing harmonized measures across multiple international studies, this data set creates new opportunities for comparative aging research and helps advance our understanding of social isolation in later life. Thank you all, and we're happy to take any questions.
Thank you, Yuzo. So briefly, just to wrap up before we get to the Q&A, I want to also introduce the Gateway Research Workshop that we're having at this year's coming GSA. This will be a half-day workshop on November 4th. That's the first day of GSA before the symposium starts. We're soliciting proposals that focus on analyses using either of these two new cross-country data sets that you just heard about or other data resources that are available through the Gateway Data Enclave. As part of the workshop, participants will briefly present their research proposals and some preliminary progress, and they're going to receive feedback and hands-on assistance from Gateway staff and other senior researchers who will be there. For all accepted participants, we're offering a $300 travel stipend to offset the travel costs. You can find the application to apply at g2aging.org/enclave, and applications are due August 3rd. Because we've designed the enclave to kind of lower a lot of the technical barriers to doing cross-national research, we've also tried to make sure that we're not introducing too many extra barriers in using the enclave. So we've tried to develop a lot of user assistance. We have a user guide with clear instructions for accessing and using the enclave. We maintain a specific Gateway Enclave help email. We also hosted some other webinars just like this one today. And we're hosting these Enclave workshops as part of GSA. This will be our third version of those to help kind of kickstart users and researchers into being able to work inside of an Enclave and to help us improve the Enclave as we get feedback from more researchers doing this kind of analysis in our Enclave environment. We do ask that if you use the Gateway Data Enclave or any of the resources provided or built by the Gateway, that you would include this citation, citing that our funding comes from the National Institute of Aging. This helps us keep track of all the wonderful work that you all are doing, and also helps the NIA understand kind of the power of investing in cross-national research. So you can learn more if you go to g2aging.org/enclave. You can apply to the enclave, both public use or sensitive use there. You can also apply for the GSA workshop there. And as I mentioned, we have this dedicated help email, enclave@g2aging.org, where you can get access. You can email us specifically on Enclave questions or about the GSA Enclave workshop if you have any questions. And with that, I think we're happy now to turn to answer some questions. And I see that we have some questions already. The first question is, so chronic condition data is currently only available for comparisons between the US and England. Do you plan to add other countries in the future? And Zuchi, I'll let you answer that one.
Yes, the dataset is currently limited to studies available in the Gateway Enclave. We started with HRS and ELSA because they have the longer period of observation times, up to about like 20 years from 2002 to 2022. And they're highly aligned measures. Other studies in the enclave are also available, such as LASI, but they only have one wave, which makes them less suitable for longitudinal chronic conditions resources at this time. So that's why we started with ELSA and HRS first.
But certainly, I think if you were interested in chronic longitudinal or chronic conditions across countries at a particular point in time, there's no reason you can't combine those existing studies that Zichi just mentioned to have kind of a wider set of countries for a more narrow set of time. And then the next question is, are weighting variables also provided for each data set? So yes, we have included inside of each of these data sets both unique identifiers for the original data. So for instance, if you ever wanted to merge in some variable that we didn't think to include that's helpful for your research into this analysis data set, you can do that. But we've also included, I think, things like weights and other sorts of variables, clustering or stratification if available. That's to help you conduct your analysis. And feel free to ask any more questions as we do have some more time. You can also just raise your hand if you would like to ask a question out loud and I can unmute you, or use the chat or question and answer panel. All right, assuming that there are no other questions, feel free to interrupt me as I'm closing out here with a question. Oh, we got one more there. Can one purpose to use enclave data combined with other HRS harmonized studies that are not in the enclave for the GSA workshop? Or can one propose? The workshop itself is designed, I think, to facilitate primarily getting started with enclave data. I do think, for instance, I think we'd be really open to if you have access to another data set that's not in the enclave that you wanted to do in conjunction with a study that was on the enclave, that would be like a good way to kind of be able to craft a proposal that we would think like, oh yeah, this person is getting used to the enclave and using some of the resources, but certainly if you wanted to include some other studies that aren't in there, you could do that. Feel free to, if I answered your question fully or not, let me know. And if you have any other questions that you think of after the webinar today, again, please feel free to email us at enclave at g2aging.org. And we can, discuss with you. Okay, I'm glad that I answered that. All right, well, I'd like to thank everyone for joining the webinar. As I said, please go to enclave or g2aging.org/enclave if you want to find out more information about the enclave or the GSA workshop. We certainly hope that we're going to get lots of interesting proposals. The last two workshops that we've done at GSA have been really great. They've been very collaborative. I think they've started kind of research collaborations of people working on similar things who didn't know each other before. And that's one of our goals with these. GSA workshop is to also help us all kind of build our own research networks. So thank you, everyone. And we'll have this recording available on the Gateway presentation site. Good day.